Welcome to Leaders and Legends, a show about the very best doctors in regenerative, orthopedics, and sports medicine. I'm your host, Dr. Charles Mahl. My goal is to give you an in-depth look into the lives of the top experts in regenerative medicine, the doctors' doctors, who are globally recognized for their skill, compassionate care, and commitment to finding cures. These are the physicians who teach internationally and nationally, the ones I would trust with my own care, and the absolute best of the best. How did they get so good? What makes them tick? In each episode, I sit down one-on-one with these remarkable individuals to hear their unique stories. Whether you're looking for a few life lessons or you're a fellow physician hoping to pick up a clinical pearl or two, this show is for you. So sit back, relax, listen, watch, and enjoy. Thank you. I'm Dr. Mahl. Welcome to Leaders and Legends, the best regenerative interventional orthopedic medicine doctors. This show is sponsored by the American Academy of Orthopedic Medicine. I'm your host, Dr. Charles Mahl. I am delighted and happy to have as my guest today, Dr. Wajid Burad from Cancun, Mexico. I was going to say you were born in the Yucatan, I know, right?
Yes, yeah, it's the same area.
In that area, all these years.
All these years.
It's one of the most beautiful areas in the world. Because of you, I've been there a few times, so I love it.
I like it too, and I've been out to study, to learn new stuff, but
You always come back. You have a family there too now.
Yes,
right?
I have my family, like all my family, from my parents to my wife and kid. So everybody, it's in the same
What a
place.
place to live, folks. I'm jealous already, and we're just starting the show. But actually, I want to tell you that I met Dr. Burad about 13 years ago at a mission in Cancun where we treated several hundred patients. He was hosting us down there. He had an early passion some 20 years ago for regenerative medicine. Tell me about how you started in regenerative medicine.
Actually, it was in Cancun. There was a sports medicine conference, and I met Dr. Brian Scheipel.
There you go.
Yeah, a member of this organization.
Oh my God, yeah.
And
He brings everybody in.
Yeah, he gave this amazing talk on prolotherapy of the ankle. I remember.
That was the first time you heard the word prolotherapy?
That was the first time I actually heard it. So I got close to him and I said, where do I learn more of this stuff, right? So he led the way. He sent me to one of these conferences. That was like 2010.
Gotcha.
Yeah.
Mm-hmm.
And from there, it all started. I was in that moment. It was like 2 years after I finished my residency program in sports medicine. I think it has happened to you and everybody in this regenerative world that we have all this amount of patients with pain that are not surgical patients, but we've done everything that they taught us in medical school.
Absolutely.
And I was in that gray zone of finding something else. And then I met Brian. Then he introduced me to the prolotherapy world. And since that, I always tell other doctors, it's like stem cells are cool and PRP, but prolotherapy is the entry. It's the door. It's the door to the regenerative world.
What I call my stage 1 regenerative treatment is prolotherapy. Then stage 2 is platelet-rich plasma or variations, and stage 3 is my stem cells. But the point you make about prolotherapy, and I'm smiling because universally all my guests say the same thing. It's like we're at a conference and we're falling asleep, and all of a sudden you hear someone speaking that's making sense to you. And you open one eye and you open the other, and you realize that what they said really is interesting. And we're the type of people, everybody sitting here like you, who once we hear that interesting lecture or what they're talking about, treatment, we go up and we meet that person universally and we become friends, and then we learn from that and move on. And just the way it works with all of us.
Yeah, it works like that. I think great part also of this organization is that we meet every year, sometimes more than twice a year.
Mm-hmm.
And we have all been growing together and learning of each other. And
there's a bond and a friendship with people here. We all want each other to do well.
Of course. Actually, after this conference, I miss you all guys, right? It's we have a good time, we learn, and we know what everybody's doing all over the world. And obviously, that translates for every one of us to treat our patients better, have better outcomes. That's also what matters.
And tell me, you've been active in AEOM since 2010, and you now run our whole country of Mexico division, but you've also done the CUMDA. I want you to tell us about CUMDA.
Yeah,
I want to know about it, because I think that's wonderful.
Well, yeah, as you say, I started with the ALM. I think that our first brigade to help people, and it was in Cancun that I participated and organized.
Was it outside, right?
13. It was in the Red Cross in Cancun.
I remember it was just like 120 degrees, and I was sweating.
It was a little bit.
But it was wonderful.
I've been doing this for a lot of time, but then with some other doctors in Mexico, we say, okay, it's cool, it's great, but we have to give it. We want to give it a more academic profile to this thing. So we did an organization that it's a school, let's say like that. It's part of the University of Yucatan.
Training.
Yeah, so that we can have very specific trainings. And we have basically two trainings. Our MSK training that involved a little bit of everything, basically prolotherapy, a little bit of ultrasound, and then a little bit of all the orthobiologics. And then we have the ultrasound 1 year long training.
See, these are not only business decisions, but this was the decision from your heart to help people, because like you realize there are so many people in Mexico, just around where you live in the Cancun area, that you can help with something as simple as prolotherapy. Exactly. And so training other docs, because you can't handle the whole world population.
Yeah.
Training other docs became your mission to teach them so they can go out to their communities and help their people.
Yeah, when I started, and this has a double purpose, because when I started prolotherapy, thanks to all of you, the organization, and I was the only crazy guy in Cancun doing that. Nobody even knew the term prolotherapy. So part of my mission was only not to teach patients that prolotherapy works while performing prolotherapy, but was also teaching other doctors to do prolotherapy and see that it works.
Exactly.
And now I can say that after it's almost 15 years, now there's a lot of guys, even orthopedic surgeons that before were totally like against. Now, at least in Mexico, in practically all the orthopedic surgeries congress, there's orthobiologics or a regenerative part of the congress.
Yeah, they're learning.
Exactly. They incorporate it because they know it's a win-win. Sometimes patient needs surgery plus orthobiologics or orthobiologics.
And what I find is the orthopedic surgeons have sort of lagged behind us in the non-surgical world, because when we treat a joint or an area, we're doing a total joint. We're doing all the ligaments, all the tendons, and they're coming from a background where they gave one steroid injection and that cures everything. And it's not like that. You can't give one injection in the regenerative field. You have to treat the whole area. And we learn that ligaments, tendons, muscles, and nerves, and get everything. So I find it very rewarding, and I know you do too, because we teach together.
Yeah, I do.
We love this. We have a passion for it, what I call patient-centric care. Patients know that you feel you want them to heal, you want a success. And you have that leadership ability, leaders and legends, where you're helpful to train other doctors to pass this on, because it's so important for these people to get care for chronic pain.
Yes, of course. I think chronic pain and how it affects our society, our families, and how it disrupts, quality of life and life in general. It's heartbreaking sometimes.
Terrible.
And sometimes I get home after, a full day of patients, and I feel so tired and mentally drained, because that's our work. It's like that when you see patients that are in years of pain and you're trying to fight together with that relationship that I'm going to do everything I can to help you. You have to put on your side also. And sometimes when we talk like this type of injury or something has no really specific treatment, where people they just put you the tag of chronic pain. You're gonna have pain.
Live with it.
Live with it. it's very difficult and it takes a lot of energy to
And
work.
not only that, but it's the education of our patients too, which is we love what we do with regenerative medicine. It is very rewarding to get successes, but it's not a magic bullet either. It takes time to heal. So my patients over and over again, I have to tell, this is going to take time to heal like a surgery because we're regenerating tissue. It's not overnight. You can't go out and play tennis tomorrow or you'll be back here for more of what I do.
Sure. The other thing that every time I get more into this is preparing the patient for the regenerative treatment, because we live in this society that everything that we eat, drink has sugars, has toxics, has
There you go.
all these chemicals. And we also see that sometimes any treatment is not working properly because the whole patient's health is poor, right? And even with us doctors, most of us doctors, we are not taking enough
Supplements and vitamins and normal
sun,
healthy food,
sun, healthy food,
vitamin
and rest.
D. Yes.
Yeah. So
Yeah,
I
absolutely.
try to make an impact, try to live by it also, and trying to be an example of that also, so that, you know, I don't like only just to talk, but to do it.
You're not put in a box. You really have to take care of the whole patient, which is make them better with everything else they're doing, or the regenerative stuff doesn't really work that well.
That's also true. Yeah, I think when people hear, you know what, my friend did this treatment, didn't work, I think that people are not being honest also sometimes on their own situations. You know, overweight, diabetes, all these other pathologies or diseases that decrease the effectiveness of any kind of treatment, and teaching other doctors and people to first get your body into a, let's say, a neutral state, but not an inflammatory state, so that we can push a little bit to start healing. It's easier than just try to heal something that it's inflamed and it's lacking nutrients, and even the mindset, it's not in, you know, in time right now for healing. Everything will help.
Put it all together.
Yeah.
Am I wrong? I think you won an award in the country of Mexico for your medicine, for your doctoring, like a best doctor award, or was it in Cancun? You're no longer the crazy one.
I'm no longer the crazy one, and actually, I'm the one pushing the new generations.
I love it.
In my end, in my corner,
Good.
you know, to push even the new generations, because most of them, they come out of, you know, school and residency with very square ideas. And this world, what we've been hearing here these last 2 days,
Yeah.
all the stem cells, peptides, ozone,
Exactly.
all the things, sometimes it's overwhelming. And some people like to just to stick to what they learned, they did, you know.
And not change for 40 years. You know.
Yeah, the thing is that
You get left behind.
You get left behind.
Someone said here, one of my guests said, medicine is constantly changing and you have to change with it. And I think that's a proper statement.
I think it is. And the problem for us sometimes is that it changes too fast. So we have to keep up with it just to stay in the game.
Yes, true. Let me switch gears for a minute. I want to know what you do for hobbies in Cancun, because I know Cancun's not a place to go diving or swimming or whatnot.
Yeah.
Where do you find fun in Cancun?
No, yeah. Well, actually, Cancun has a good beginners diving. We've been diving. Some of the guys over here, they have a very shallow reef. So
if I lived there, I would never leave. I'll tell you right now. I have everything I need.
Yeah. So Cancun, I cannot speak anything, you know, bad of Cancun.
You love
it. Has given me everything. Cancun has obviously the beach. It has the jungle also.
Great restaurants.
A fine restaurant. We have nice places to go out for different type of cuisine. And also, I was born in Cancun, and when Cancun was a little town. Okay, so I have friends from those ages.
All ages. That's wonderful.
Yes.
Long-term friends.
Long-term friends that we grew up together.
Who are not doctors and not doctors.
Everything. All the hotel zone was like our backyard. None of
that's pretty cool.
These now big hotels that didn't exist. So we have a very nice community.
Growing up.
Okay.
What were you like as a kid? Like, did you know you wanted to be a doctor growing up?
I think, yes, around 12 years old or something, I look up for one of my uncle, that he's a doctor. He was, I think, Cancun's second doctor to arrive.
Wow.
Yeah,
Impressive.
when it was a tiny town. I always liked the biology and the chemistry more than the mathematics. Then I learned that we see a lot of mathematics also.
Chemistry, yeah. Most of what we do is math.
Yeah, exactly. But yeah, so I went to that side. And also, music is my passion. I know yours too.
What do you play?
I play guitar, I play the bass. We have a karaoke night every week. I tell my friends that
I'm going to start practicing more now.
Yeah.
So when I come down to visit you and we do
yeah,
Puerto Vallarta mission, I'll have my
I have my band, and we've been playing together since we were like in the 7th grade. So it's been
off camera. I'll show you my pictures.
Okay.
Okay. Yeah.
I've seen some of you playing the guitar
Yeah,
and the records and everything. Yes, I like it. I talk to my patients, and they're my psychiatrists, they say.
They're your outlet. Yeah.
They're my outlet. Instead of going to therapy, I go to music therapy. We play, we sing, and I think that's soul, increases your soul also.
And one of the common grounds that we have, all my guests, myself, the way we practice medicine and sort of run our life is we're always learning. We're always learning, always doing things. Music is a language, another language, like medicine is a language, like Spanish is a language. And you're fortunate enough to speak Spanish and English, music language, medicine language. It's a wonderful life when you have that, you know?
Yeah, I feel
It is.
very
You gotta
fortunate.
teach your daughter that too.
Yeah, my daughter, she's almost 8 right now,
Yes.
and she already plays the piano.
I love it.
She goes to sing. She's very artistic. She
Good.
likes to paint, and she dances, goes to ballet and jazz. She dances so well, and I would say she's my princess, and I love all the things she's doing.
She's your world.
Yeah, and I'm enforcing at least it started all one artistic thing. I think everybody should have at least one artistic thing because it grows. And now she speaks 3 languages, so Spanish, English, and Serbian, like her
That's
mom.
wonderful.
So she's trilingual.
That's
right now.
wonderful.
So,
Yeah.
So
Well, tell me, what do you have in the pie coming down? Because you and I have a connection through global stem cells.
yeah,
I go back with them to about 2010 or whatnot, doing things in the States with them. At one point, I was their second speaker in Latin America talking for them. I've been to some of the places you're at now where you're doing all these wonderful, innovative things with stem cells in the Cancun area. And these are professionally done by world-class top docs in Cancun, where I've seen them do intravenous stem cells, and the cardiologist and interventional radiologist, you know his name, I forget the name right now, would travel and take it to the heart.
Dr. Bogel.
What a wonderful man. I was crying when I watched him work because I felt it. You know, I feel like I feel little tears in my eye. But the guy is a magician.
He's amazing, yeah.
Wonderful, wonderful doctor that I met. And doing things that are just the cutting edge of medicine, that I hope these things will give people successes. Paralyzed patients from bullet wounds or car accidents. Yeah. And he was just doing things that it was magical to me. Yeah. Wonderful.
I think I'm fortunate enough that other organizations also asked me to collaborate with them.
As you should.
Treating patients with very specific pathologies and using like I would say the world's best stem cells, like all the research that they're doing behind it's terrific. And so we're doing stem cells in spine, in knees, any joints, also IV.
Because the United States is lagging behind the rest of the world. We haven't been able to do IV stem cells here unless it's a special case that we get approval for. In the state of Florida, where I am, as of July 1st last year, we just got approved for Wharton's jelly stem cells. Since then, before then, I've been doing bone marrow stem cells and fat, but now I have the opportunity to use the Wharton's jelly. Patients they really are excited about this because I don't have to do an invasive procedure on them.
Of course.
So it's opened the whole world. That's like the back of your hand now. It's second nature to you. We're just learning this here. But
yeah, I've been fortunate enough to be walking this path for over 10 years of experience with Wharton's jelly, stem cells, and exosomes and combinations with collagens, with peptides. So yes, we're
Put it
trying
together. We all want to help people. That's what we want
Of
here in the
course.
States. So it's happening. Well, I want to thank you for being on the show. I hope you'll come back.
I hope.
It's been a pleasure having
Thank
you
you so
today.
much. I will love to come back.
I am a huge fan of you. I know what you do for the citizens of Mexico and in helping take care of chronic pain, and not just in your own practice, but like we talk about over and over again, the kind of heart you have in training other doctors to pass this message on and help other people that you can't handle yourself. So you're a wonderful man and wonderful doctor, and thank you for being here.
Thank you, Charlie. And I owe that also to you, the organization. We all have like the same mindset, and we like to to treat
Just want to
people,
do well.
yeah, and contribute with our grain of salt
With our grain of salt.
for our community. That's
There
it.
we go.
It
Thank
might
you again.
seem crazy what I'm
All
about to
right.
say.